Okay, so my name's Grainne Forsythe, and currently I'm the lead reporting radiographer in the Southern Trust. How this came about was we had a radiology review in 2012, and there were a few of us reporting radiographers, but we were in isolated sites throughout the Trust, and we weren't actually communicating with one another. We were only released for reporting when our own site would allow us to be released. There was no real service as such. So we came together as a group through the radiology review, and we were empowered to see how we could improve this service. So this is what's happened. So at the minute there is a reduction in the amount of radiologists throughout the UK. There's not as many being trained, maybe going into radiology, and then maybe when they are going into radiology and qualifying, they're maybe going to Canada, specialising. It's difficult to get them back, or some of them are just going straight into private. It's hard to keep them within the NHS. So radiographers are extending their roles into to provide patient-focused solutions, and they can alleviate some of the problems that arise from the radiology shortage in Northern Ireland. In 2013, there were 4 radiographers qualified in plain film reporting from Salford University, and we were only reporting the minor injuries from South Tyrone and Armagh. So that's just the limbs we were doing, really knee down, elbow down, the rest was just going to ED. There were 31,138 examinations from ED in Craigavon and Daisy-Hill, which we could have reported, but they were receiving an IRMA report. And reporting radiographers could have been better utilised. You might be asking, what is an IRMA report? An IRMA report is where the referring clinician has looked at the image and has scribbled his findings in the patient's notes. This was maybe a junior doctor and then checked again by a consultant. But if you imagine your consultant in ED, he's maybe trained to do the clinical aspect. He's not actually a radiologist that's actually sitting behind a workstation looking at image after image. Maybe somebody comes, interrupts him, takes him away, asks him to look at another patient. There are dangers with that things still can be missed. So in 2013 we were interviewed, and I became the lead reporting radiographer, and it was my task to roll out this service to the Southern Trust to see how we could enhance it further. So all appendicular and axial examinations from ED and MIU, excluding chest and abdomen, would be reported by radiographers. There were 2 further staff sent on, to be trained in Salford, with a view to extending the service into a 7-day service. So we have 1 radiographer in South Tyrone, 3 in Craigavon, 2 in Daisy-Hill. Our mentors are Dr. Porter, Dr. Gracie. We had a mentor in Dr. Hall, who was very proactive in rolling out this service, but sadly he died in April there. Even though we're all cross-site, we're actually Southern Trust reporting radiographers. Okay, we report from a Southern Trust list, regardless of where we are. Governance issues, 1 in every 100 examinations that we report are audited, and 1 in every 20 axial examinations. The reason why there's greater checks on the axial is because it's a newer service. We're reporting spines. There's a greater implication there if a spine fracture is missed. So we have to prove that our reports are not any less accurate than a radiologist. So there's bi-monthly discrepancy meetings with our mentors where we would discuss overcalling or undercalling. There will also be a PowerPoint presentation on an interesting article, and one of the radiographers would give that to the rest of us, so that and we take turnabout as to who presents it. It's just part of CPD, keeping up our knowledge of classifications, fracture classifications, what the doctors need to know. And we also have bi-monthly team meetings with our site leads, where we disseminate information where we reckon that maybe junior staff need further supervision or training in getting better technique images. So you can see here, as the radiographer reporting has increased, this red line, that our activity has gone up, and then the IRMA reports have actually gone down within the Trust. Reporting turnaround times, at the very start of the service, they were all over the place. But if you look at this blue line, this is 0 to 2 days. And you can see the vast expanse between 0 to 2 days and then 3 to 7 days. So we are making improvements. So then in 2013, all examinations, excluding chest, abdomens and paediatrics, were getting an IRMA report. Now, 74.5% of ED examinations get an official report within 14 days, with almost half being within 2 days. Out of those, you're saying, well, there's still 25% there. What's happening in those? Those are the patients who have maybe been put in plaster of Paris, and the medical doctors or the trauma orthopedic doctors, they don't want to know whether we think something's satisfactory. They can guess that themselves. You know, they've treated the patient. So there's no necessity for us to report those. So there will always be a certain amount of examinations that will get an IRMA report because they're under the care of the trauma and orthopedics. So our achievements so far, the number of reports undertaken by reporting radiographers has increased from 14,500 in 2012 to 2013 to over 42,500 in 2015-2016. That's a threefold increase. And outsourcing these plain films to the likes of Medica would have cost the Trust £182,000. So there are savings there. IRMA reports have reduced and reporting turnaround times have improved. Our team of reporting radiographers also hosted a trauma imaging study day, educating radiographers and emergency nurse practitioners throughout Northern Ireland on the 10th of September as to how to look on an X-ray for the signs of trauma, fracture recognition, things like that, implications, fractures that you should never miss. All of the above was achieved with better utilisation of resources, rostering different things, and employing 2 lower band staff to release staff for reporting. So there's 2 band 5s taken in, and that released the whole 6 band 7s to go 50% of their time. We were runners-up in the UK Advancing Healthcare Awards in 2015 for maximising resources. And looking to the future, NICE guideline states that a radiographer or a radiologist or a trained reporter should deliver a definitive report to the emergency department before the patient's actually discharged. With 6 radiographers, that's not really very feasible, but maybe on if 2 trusts were to merge, we could provide that service, or maybe we'll look at it regionally. But from the Southern Trust point of view, we have the most trained reporting radiographers, and we are leading the way in Northern Ireland, but we are well behind the rest of the UK, especially England and Scotland, where they're doing GP reporting and they're doing chest and abdomens, which we are not. We're breaking down the barriers slowly and surely. Only this week we've taken on to do ward trauma and GP trauma reporting, and it's just gone beyond ED and MIU now. Thank you.